Good morning, good afternoon, and good evening, everyone. Welcome to this week's Global Café. My name is Kara Cruz. I'm a policy and project coordinator at the IFA, and I'm very pleased and excited to be moderating today's discussion. So this week, I have the absolute pleasure of introducing Dr. Thiago Hérick de Sá for the topic of supporting cities and communities in being age-friendly environments. Thiago holds a degree in sports science and a master's and PhD degrees in public health. He started his career as a physical educator, working with older people in hospitals, primary care settings, and households in Brazil. In 2010, Thiago worked as a researcher in Brazil and in the UK with a track record of scientific publications in high-impact journals. In 2017, Thiago joined the World Health Organization to support work around urban transportation and health, including the development of the WHO's Urban Health Initiative, as well as the WHO's Urban Health Research Agenda. In 2022, Thiago joined the Department of Social Determinants of Health to lead the work of the age-friendly environments, including the Global Network for Age-Friendly Cities and Communities. As a non-state actor with official relations to the WHO, the IFA provides direct support to the WHO Secretariat of the Global Network. So it really goes without saying that Thiago's experiences, achievements, and his background positions him as an ideal expert for this week's important topic of age-friendly cities and communities. We're very excited to have you today, Thiago, so thank you for your time. So to start off, you have a background in physical education. So how did you transition your career to eventually lead the work of the World Health Organization on age-friendly environments?
No, Kira, it's really my pleasure to be here today, and it's been excellent to work with IFA and many other colleagues, many of which actually among the participants today. For me, it's been now 1 year into the job, it's been a privilege to be part of the family, and to work on a regular basis with many of you. So thanks for the opportunity as well, and it's a great pleasure to be here and have a discussion around age-friendly environments. Well, how I started this? Well, I started my career actually as a personal trainer, as a football referee, and as a water rafting guide instructor. That was the beginning of it. But one interesting thing is that physical education is actually a health profession in Brazil. So I also worked, and I was eligible to work as a volunteer in primary care settings and hospitals. And I did that mainly with groups of older people, both for health promotion, but also for disease prevention and treatment even. I was working with a multidisciplinary team in the hospital to support treatment of older people with chronic conditions. So that's kind of how things started. And then, of course, through that engagement, I discovered and fell in love with public health. And I think that the nice part of public health is that potential that you have to help so many people, right? Yeah. The disadvantage as compared to a clinician is that you don't necessarily see that people in front of you, as I did in those opportunities. Now, but I think that was like what triggered me. So then I went back to research. As you mentioned, I did my research on urban health, including on different population subgroups, on how communities can make our lives, our health, our well-being better or worse, depending on how they're planned, and how we can actually work together to improve it. So that's how I quickly transitioned to public health and then strengthened my skills. Then in 2017, I found this position, found it very interesting, applied, got the job. Joined the organization in March 2017 here at WHO headquarters to work on urban environmental related issues. And then since last year, I am the responsible officer for age-friendly environments here at the Department of Social Determinants of Health, Demographic Change in Healthy Aging Unit at headquarters.
Well, thank you. That's quite the progression from a whitewater rafting guide all the way to WHO. Do you find that you kind of apply any of the lessons you learned while acting in a more clinical capacity to your job now?
Oh, a lot. And I think that having diversity of experiences really helps, because then by analogy, you can oftentimes not build on skills that you have developed in a different context, but you can also not more easily walk in the shoes of other people. So because I have that experience working on primary healthcare facilities, primary social care facilities as well, hospitals, even though I am not a clinician myself, I can recognize the challenges, the opportunities, the approaches that my colleagues face. Also, for example, for my experience as a water rafting guide, as you can imagine, I had to interact with people quite a lot. Mm-hmm. And community work has a lot to do with interpersonal skills, face-to-face, being able to listen, to exchange, to learn from one another. So definitely, and I encourage, especially early career colleagues, like if you can have more experiences, diversity of experiences, and not be too narrow to your field, that can only bring you benefits and additional skills and competencies that you can then apply later on.
Yeah, certainly. So before we dive into speaking about the global network for age-friendly cities and communities, could you start off with describing what kind of the perfect age-friendly city would look like?
Oh, a perfect age-friendly city. That's a tricky one, because cities and communities are so different, huh? And they themselves change over time. So I think that the most important thing for age-friendly cities and communities is that, one, first and foremost, they ensure that all the people are at the center of the decision-making process, right? So as many colleagues from the global network like to say, nothing about us without us. And I think it's important that we see all the people and their families not only as beneficiaries of whatever we do with the cities, the communities we live in, but agents of that transformation, right? And they are doing a lot already. So it's acknowledging what they are doing and making sure that we have the mechanisms in place for them to be able to do even more. And I think that it's also important to acknowledge the diversity in this group, right? I was just reading the news yesterday, and I saw this 92-year-old gentleman that runs 60 meters in 11 seconds. And so how many people can do that? Not all the people. How many people can do that, right? So some 92-year-old people are running sprint races, marathons. Some of them are taking new careers or at the university. Some are in need of intensive and long-term care. And I think that a city or community that wants to aim to be a perfect age-friendly city has to ensure that all those voices are heard, that they are engaged, meaningfully engaged in the process of developing their own cities. Now, of course, we have to ensure that these cities, they plan and act on issues that matters to all the people and their families. And there are, as you know, the WHO framework advocates for at least 8 domains of action where to intervene, from housing to jobs, employment, transport, health, social care, civic participation, social inclusion. Now, I'm sure that a lot of the colleagues attending this event today already know that, but for those that don't, I really invite you to have a look. Of course, some cities, they add one, some cities combine others, but it's really important that a perfect city manages to address what is relevant for all the people. And then the last point, I think, is the ethos, if you will, the approach for this work around becoming more age-friendly, which is to understand that this is not a box that you tick. It's not a one-off exercise. Okay, I go, I do this and this and this, done. I mean, I am age-friendly. No, because, well, as I said, cities change, all the people themselves will also change. So we have to ensure that an age-friendly city or community understands that this is a continuous process, right? There are cycles to be done. just so that we continue being and aiming to become more and more age-friendly as we progress collectively.
Yeah, and it's certainly like adapting to the changing needs of older adults, right, as well.
Definitely.
So a major component of the WHO's work on age-friendly environments is to assist cities and communities in becoming more age-friendly. So how do you support this, and how does your department kind of work together to do so?
A lot of the supports, a lot of the activities, of course, happen under through the global network for age-friendly cities and communities. And the global network has a vision where all cities and communities work towards becoming a great place to grow older in. So the mission of the network is precisely this, is to stimulate and enable those communities from around the world to do so. And a lot of what we do is through inspiring change. So showing what can be done, how it can be done, connecting cities and communities to facilitate the exchange of information, knowledge, but also trying to remove some of the barriers for that exchange to happen. Geographical barriers, language barriers, many different types of barriers that cities and communities face to benefit from such a network. And of course, support them with appropriate, innovative, evidence-based solutions. Now, I don't know, some concrete examples. WHO and IFA run capacity building activities together. We have our age-friendly environments ECO mentoring program, where we mentor people. We try and enable people that are willing to initiate this work on age-friendly environments, building on the experience and expertise that already exists. Last week, we had a meeting with all the 11 Polish cities, with the support of our colleagues from the WHO, Europe, but also the country office, to discuss how age-friendly citizen communities can do better in the context of emergencies. And we also had the chance to discuss with them, plus several stakeholders in the country, on how to develop their national program for age-friendly citizen communities. We saw that, and perhaps I can speak more about that later, but we saw that cities and communities that have that additional support from the national level, they tend to perform better. And then maybe another one to highlight, this is very recent, is the twinning agreement signed between age-friendly Ireland and New York City, building on the historical connections of Ireland and New York and many other cities in the US, actually, for technical cooperation, again, under the umbrella of the global network. So how New York City and Ireland can learn from one another on different areas of work, on public safety, on age-friendly employment, airports, age-friendly homes. So there's age-friendly businesses. There's a lot there. And I think that this is really what we try and achieve. Use the WHO strengths, and of course the platform that we already have with the global network to foster, to inspire people, to facilitate connections, to facilitate a dialogue, and then to support them in finding the evidence-based solutions for whatever is relevant for the people in their local context.
Yeah, it's an exciting initiative to be a part of, just to see all the different ways that cities approach being age-friendly. So I see in the chat, Valerie Powell has shared that her community has heard that it's quite a high bar to become recognized by the WHO. Could you kind of walk us through the process for a city to become part of the network?
Of course, Kira, I can. So the approach we take with the global network is quite inclusive, because what it means to be a member of the global network for age-friendly citizen communities is that you are committed to become more age-friendly. It's not a certification or an accreditation that you are age-friendly, because you just saw me saying there's no such a thing. Now you have to continue working towards becoming more and more age-friendly. So what it requires to become a member is a letter signed by the highest possible representative of that city or community. Oftentimes the mayor, like it's not necessarily always the mayor, because sometimes the word is big and the way local authorities are organized is different, but oftentimes there's a mayor. So we need a letter signed from the mayor committing to follow WHO framework, committing to become more age-friendly, committing to also share and engage in the activities of the global network. Like we don't want people that just come and be part of the network without actually contributing to it, and without taking action. So it also requires as I said, the WHO framework to be followed, but of course, the regular sharing, and then the basic criteria is that the city or community shares at least one age-friendly practice a year. Now, a lot of them share much more than that and engage much more than that, and this is why it's fascinating about the network. And I think that one important aspect here, Kira, for us is really to try and have all the commitment letter, but also the action plans, the activities implemented, and the evaluation of those plans, of those activities in what we call this age-friendly cycle, all transparent. So we invite all the cities and communities that are part of the global network to actually have that in their profile pages, just so that people living in those communities can also go and check and see, okay, you committed to do this. Are you really doing this? But also in doing so, we facilitate the exchange, because then all the cities and communities can see what the plans are for a certain community. And oftentimes they get together also based on what they have in common, like rural communities talking to rural communities, large cities to large cities. So all that to say that it doesn't take a lot, in a sense that it's mainly the commitment and the sharing and the following the WHO framework that has been successfully tested and applied in now more than 1,450 cities and communities from around the world. But it does require an active engagement and mobilization throughout this process.
Yeah, for sure. And also, I guess.
And Kira, sorry to interrupt. Just one thing that I forgot to mention. It's oftentimes common that these networks, they charge membership fees, which is not the case of the global network as well, because we want, first of all, we know that sometimes membership fees limit the participation of low and middle income settings, but also rural, remote communities from high income countries or small towns. But we want to make sure that every single penny that a city or community has is actually invested in the work itself.
That transitions really nicely, actually, to our next question from Shmuel. So Shmuel joins us every single week and asks fascinating questions. So for this week's question, Shmuel asks, what do we need to do to support cities and communities from poor and developing countries to become age-friendly environments?
Well, that's an excellent question from Shmuel, because if you look at the map of the global network, and if you have not shared, Kira, colleagues, I kindly ask you to share the link of the global network with the participants. Mm-hmm. If you look at the map, you will see big blanks. You will see large areas where certainly a lot of action is taking place, but that are not necessarily have a member or an affiliate program within the global network. And it's by no coincidence that that's where a population is relatively young, in terms of mean age, but it's also the places where population aging is taking place rapidly. And I think that one very important and initial aspect that somebody can do in his or her own capacity is to serve as a champion, to serve as an advocate, to say, look, yes, we have, if you come from a low and middle income setting, look, we are, even if we are a relatively young population, well, we are aging rapidly. In many cases, we are also urbanizing rapidly. So it's a great opportunity actually to prepare, because we know the trends. So instead of reacting to these trends, we can be proactive and already build the societies, the infrastructure, the mechanisms, the services that will actually respond to that. In many cases, you already have age-friendly programs. You already have age-friendly citizen communities. You already have national, subnational programs of age-friendly citizen communities. So you can certainly engage in many of their activities, either with your expertise, or a lot of them actually have paid staff that are older people, but also as volunteers. You can engage through the older people's councils. So there are different political structures through which that oftentimes are already embedded in the governance structures of these programs. So you can also try and influence and be part of that through those mechanisms. And then, of course, try and engage in the consultations, in the exchanges that happen frequently, not to mention, of course, the activities themselves, the practices themselves. So, I mean, there are many different ways through which, older people or people in general can actually contribute to build more age-friendly societies. Certainly. Which is certainly facilitated if you have those programs, those mechanisms in place, because then you not only have the structures in place, but oftentimes you also have resources attached to it. You already have a plan laid out, which is this common understanding of where we should invest our time and energy, which direction to take. So once again, if your city or community doesn't have a program and is not necessarily part of the global network or of the national network or subnational network, that in some cases already exist, I do invite you to serve as a champion, an advocate for them to start thinking about the idea of developing something similar to what many others are already doing.
Yeah, I think it's critical to have those. A participant has spoken about unexpected allies of contributing to age-friendly environments. So Dominic, would you like to ask your question to Thiago?
Sure, thanks very much. So what I'm thinking about is here in Pictou County, Nova Scotia, we have a coalition for aging well. And there's quite a number of organizations that are involved with it. But what I'm thinking about is, how do you find allies in unexpected places, people that maybe aren't already connected in some way to seniors and seniors' health and so on? But are there other groups that we just don't even think about contacting or connecting with, but that could probably help? What have you found in your research?
So Dominic, this is actually a great question. And again, I think that oftentimes what we see through the process of applying and basing the work around the framework, the WHO framework and the domains of action, is that you find allies also in different sectors. Sometimes the transport people are already doing great stuff. A lot of age-friendly activities, interventions, without necessarily labeling those or framing those as a contribution to creating an age-friendly world. It goes without saying that grassroots movements, the communities themselves, they provide a lot of energy to this work. They're actually central to this work in many ways. And there oftentimes is easier to find the points of contact because a lot of the community work is similar and analogous. Oftentimes we also see the interest, for example, from businesses, from the private sector, that are committed, that are interested, that also can provide a contribution. And then, of course, in many times what what you find are some interesting collaborations around champions. Like some people are already doing a lot of interesting work, for example, on child-friendly communities. And then if you think about age-friendly communities, it's also about intergenerational solidarity. How do we build a society, a community that works for us all? So in many ways, what we see is that it's not very difficult to find allies, including in places where you usually do not go to. And once again, I think that having the right framework from the beginning and having the right principles from the beginning really help to try and bring these allies outside your immediate counterparts to the table.
Wonderful. Thank you, Thiago. So I see, Thomas, you have your hand raised.
Yes. I was just curious, in the United States, the AARP organization serves as the lead agency for providing support and development and guidance for age-friendly communities and those that are interested in developing into those types of communities. I know we have a representative here, I'm sorry, I don't know his name, from AARP. I wondered if he had any comment, or whether Thiago, is there a similar construct in other countries for lead agencies to take the lead and provide much more specific on-the-ground type support to age-friendly community development to extend the influence of the UN?
This is actually an excellent point, Thomas. And in fact, AARP serves as our affiliate program for the Global Network for Age-Friendly Citizen Communities for the US. And of course, provides a support as well in sharing their lessons and experiences. And it is true that same as for AARP in the US, we have other affiliate programs under the Global Network, both at the national but also at the subnational level. So I'm gonna list some, and I'll probably forget them. So I do invite you to have a look at the webpage of the Global Network, but we certainly have Canada, and that is led by the Public Health Agency of Canada. We have Quebec. We have the SENAMA in Chile that runs a national program. We have IMCESO, and they're both coming from the social side, not from the health side. IMCESO in Spain also runs a national program. We have the Older People's Commissioner for Wales that runs a program for Wales. We have the UK Network for Age-Friendly Communities run by the Center for Aging Better. We have the Réseau Francophone, the Francophone Network that supports France, but also now Francophone communities in nearby countries, Belgium, Switzerland, Office for Seniors in New Zealand. We have the government of Queensland, Western Australia, Singapore. We have, of course, Age-Friendly Ireland, which is the only age-friendly country, meaning that is the only country today that is 100% covered by local programs together with a national program. I really hope, and Kira, please help me here if I am forgetting anyone in terms of national and subnational programs. But just to say that those affiliate programs, they are doing a tremendous work. And they provide precisely what you mentioned, Thomas, that additional layer of support, that understanding also of the country context, the region context. I forgot to mention PAMI in Argentina as well. And it's precisely because we saw that cities and communities that do have that additional support that, for example, AARP provides in the US, that we developed a guide on national age-friendly citizen communities programs, which is really to complement the 2007 Age-Friendly Cities Guide for local authorities, for communities, and try and push for the development of national programs in every single member state. And this is actually not WHO saying. This is also a call from the action plan of the UN Decade for Healthy Aging. You know, we are under the UN Decade for Healthy Aging, 2021-2030. There are 4 main action areas under the decade, one of which is to create communities that foster the abilities of older people, age-friendly environments. The other 3 are combating ageism, integrated care, long-term care, and all of them can be developed, can be delivered through age-friendly citizen communities, and even better so if we have also a national program in place. Now, I also have to mention that there are many other national programs doing an immense work, a great work, that are not necessarily affiliated to the global network for age-friendly citizen communities. We have some of them in the process of being affiliated. We have some others that now hopefully will join. And I do invite those that are already taking action, already have established programs to join forces, because we are certainly stronger if we are together.
Thank you very much. So Denise, you have a question about age-friendly communities and dementia-friendly communities. Would you like to unmute to ask your question?
Hello. Yeah, I just wondered if Thiago could speak a little bit about the connection between age-friendly communities and dementia-friendly communities. I know both are prevalent topics in Canada, but maybe just your perspective on the connection.
Hi, Denise. This is a great question. Thank you. Actually, there are several points of connection with both dementia-friendly communities, also disability-friendly communities. Not only in terms of the population, and we know that both dementia and disability are highly prevalent among older people as compared to other population groups, but it's also true that people with dementia or people with disability, they will grow older in those communities as well. Now, if you have dementia early on, if you have a disability early on as well. So I think that it is really important not to account for those in the process of developing age-friendly citizen communities. And it's also interesting to align those, and we work closely with the colleagues at WHO, leading on mental health in general, but also disability, to make sure that this is the case. Also because a lot of the counterparts will be the same, several of the interventions will be more or less the same, but if you don't have a conscious look to it, you may either miss opportunities or sometimes even cause harm. So it is really important that now we try and align as much as possible the work, just so that we address what is relevant for older people, including, of course, developing dementia-friendly, disability-friendly communities, citizen communities.
Thank you. And I think to kind of add on to that, Javier Afzal has asked about green spaces within an age-friendly cities concept. So could you speak maybe a little bit more to the role the environment can play in kind of assisting a city in being age-friendly?
Yeah, there we go. Green spaces is one very concrete example of an intervention that has a strong evidence of positive impacts on health if well planned. It has an impact on mental health for the general population, for older people as well, and it can certainly be pushed or delivered through age-friendly citizen communities, should this be one of the priorities identified by older people themselves. One of the domains of action for age-friendly citizen communities is outdoor environments. But then when we think about green spaces, we should not just think about the physical environment or the natural environment, right? We should also think about the social environment around those, because or the services attached to that particular place, right? Oftentimes you have, for example, parks that have charges for people to come in. So they're not necessarily accessible, even though they are there. Now, if you have, for example, a community around those parks that are not age-friendly, right? That have, for example, ageist behaviors towards who should attend or not attend those spaces, then the benefit that we could have from implementing them will certainly be limited, especially for those mostly affected by ageism, right? So it is important. I think that is certainly one of the interventions for us to consider in a list of possibilities. But I also think that in thinking about the expansion of green areas in the city, we have to try and look at it in a holistic way, making sure that it's not just about the trees and birds and plants there. It's not just about the physical interventions that we make, but it's also about the accessibility of those space, how that space is inclusive to other people, is inclusive to people with disabilities, with dementia, is inclusive to families, just so that we can also foster intergenerational solidarity on that. And it's, of course, context and cultural sensitive, because green space is a term that for different people in different places in the world can mean very different things as well.
Certainly. And so we have a question here from Nesta. I don't know, Nesta, if you'd like to unmute about kind of how to go about prioritizing the 8 domains of action when a community has resource constraints.
Thank you very much. You've actually asked my question. Of the 8 domains of action, although they're all important, what would you prioritize in a community which has resource constraints?
I would prioritize, thank you, Nesta. That's a great question. I would prioritize what matters to all the people living there. And several communities are actually quite clever in not just prioritizing necessarily the 8 domains that are there, but eventually adding one that is important, but is not necessarily reflected in the framework, or sometimes combining some of them strategically, just so that they could also create like an alliance around some of them, but also tapping into existing resources. So there are different ways through which the domains of action, that framework can work at the local context. But I think that long story short is really what matters to all the people. And then of course, as I mentioned before, it is a continuous process. Oftentimes you don't have everything that you need in place, right? You don't have a lot of resources. Even if you are in places that are not resource constrained. And if you are in places where you don't necessarily have the resources, then you start from somewhere, you show progress, you mobilize people, you create demand for more, and then you gradually grow. And what I'm saying here is actually the trajectory of many of those problems. Some of them started like with one person and very little to start with. And then it grew as it's shown that the importance, the relevance, and the mobilization as well that you can create around those. One thing that I would like to flag here is a very, very nice publication developed by my colleagues at the region of the Americas, my PAHO colleagues, with the support of the ARP and HelpAge, on low-cost interventions for age-friendly citizen communities. Of course, very much speaking to the context of the Americas, but with some adaptations certainly applicable to many other places in the world. Long story short, having more resources is always better. And if we have the right approach and the right framework, we can do more with more resources, but it's not necessarily a requirement to have those resources beforehand, neither to have all the resources needed to tackle all the 8 domains at the same time, even if all the people identify those as equally relevant. Then we can strategically discuss and decide, okay, all the 8 are important, we have to start from somewhere. This is how much we have. Let's go with this plan. And then we see what comes next.
Thank you very much. So as you know, the IFA will be hosting the Global Conference on Aging in Bangkok, Thailand in June. And one of the themes of the conference is age-friendly environments. Could you speak to some of the innovations occurring within the Southeast Asia region regarding age-friendly in cities and communities?
Kira, many thanks for the question. There's actually a lot of innovations coming from Southeast Asia, but also South Asia, the Western Pacific. And in reality, and actually some of those are documented in the guides that I've just mentioned that will soon be publicly advertised, the guide on developing national programs for age-friendly cities and communities. But the reality is that there are so many initiatives and practices already developed under the global network for age-friendly cities and communities, not just in terms of the processes. No, we've been talking a lot about the processes. So how to put such a program in place, which steps to follow, but also in terms of the what's, in terms of the interventions themselves. Okay, so have 8 domains of action. Civic participation is important. At the end of the day, what is that I can do to address that specific domain? So I mentioned before that one of the requirements for being part of the global network is to share what you're doing and to be able to compile that and disseminate those innovative practices. We put together a global database of age-friendly practices. So instead of me listing all the innovative approaches from different regions and countries and communities, I really invite you to have a look at the global database, because there you can look and be inspired by activities reported by countries, by cities, by communities. You can filter by focus area. Let's say you're interested in housing, so you can have a look at the different activities done by these different stakeholders in housing, information and communication, social isolation and loneliness, abuse of other people, faults, physical activity, you name it. And I think that in there you can also, I know, in there you can also have access to a contact person that you can actually reach out for further details. Now, let's say that you are an officer in charge of developing a specific activity in your city or community. So you can already, through that platform, reach out to those that have gone through the process of developing a similar policy or intervention. So it is for us really like a unique resource. And I really invite you also not just to have a look, but to submit your own practices. I think that it's because again, as I said before, a network as such, as a network, only exists if we strengthen those nodes and links, right? If people talk to one another, if they exchange, if they learn from one another, if they get inspiration from and inspire others. Otherwise, it becomes like a long list of people, of institutions, and this is, and the global database for age-friendly practices is one more tool to make sure that we have energy and exchange in the global network.
And does a city need to be part of the global network in order to submit an age-friendly practice?
Not necessarily. No. Of course, and one aspect that is important to mention is that because we want also to promote evidence-based solutions, we actually ask those submitting the practices to submit any evaluation that has been done. Sometimes is anecdotal evaluation, sometimes it's a qualitative assessment, sometimes it's like a thorough, comprehensive research evaluation done to assess the positives and negatives, the process of developing that policy. So we also encourage people to submit the documentation around the evaluation of the practice itself, just so that others can benefit from that knowledge as well moving forward.
Thank you. Eileen Sweeney, I see you have a question about obstacles in promoting age-friendly communities. Would you like to unmute?
Yes, thank you very much, Thiago. I'm in Ireland, and we have age-friendly communities with every local authority, and it's been around for quite a long while. How have you come across in your research or from your experience the next phase, in the sense that how do you keep the energy going to keep this going? Because you can go with groups and champions and they move on. And secondly, have you any approaches in order to actually overcome that and re-energize? Thank you.
I think that this is a really important question. And I think that there are different ways to do that. There is an element of visioning, right? As I said before, if it's an iterative process, what happens is that from time to time, you have to revisit the vision. You have to see, okay, we went this far, we got to this level of maturity, we achieved so much, what's next for us? So I think that having that regular visioning exercise, collective exercise on how to move forward is one important element. So how do we bring people behind this vision then, right? So the first step there is really to try and develop this vision together. Also to continue being innovative. And I think that Ireland is a great example where you have so many innovative programs and ideas and approaches to making age-friendly environments, from citizen communities to settings, to programs. So I think being innovative. Being innovative is really important. Relying on champions and leaders, and also refreshing the champions and leaders, because that also helps to create momentum. And then in that, like working closely with the media, with other stakeholders, with policymakers, to make sure that you have that traction. And then one element that is also important to keep the energy going is to try and formalize some of those structures, right? To make sure that this becomes embedded in the governance structures, that you have resources allocated to it. You have human resources, you have financial resources allocated to it, and that you show results. I think one important element here is also that you show results, that you develop research activities around this, that you have a monitoring and evaluation system in place that can actually not only inform the process, but also show results, what is working, what is not working. And then through that, make sure that you have an ecosystem in place to also train people to redirect the course of action for things that are not working. So I think that there are at least, I mentioned here 6 major elements through which you should intervene to keep the energy going.
Thank you. And I see, Thomas, you have your hand raised. Do you have a follow-up question?
Yes. I'm wondering what comment you might have on the following. The age-friendly community is, as I recall, evolved primarily because of concern about the increasing older age population. But as it's grown, it's been obvious to many people that making a community age-friendly benefits all ages, from the very young, the babies, on up through the old people. But when initiatives, and I'm thinking right now of an initiative in the town of Reading that I live in north of Boston, there's a little bit of tension between development going on to expand services and facilities to support the aging primarily, but also of interest to the entire population. I'm wondering what comment you have as to whether this arises as an issue in your experience with other communities, and how do you deal with that? Are there any guidelines to trying to reinforce that age-friendly applies to all ages? Thank you.
Thomas, again, great. Thanks for the question, because you give me the opportunity to highlight the importance of intergenerational solidarity exchange activity to actually build age-friendly societies that works for actually all this and future generation of older people and their families. And in their families, we have, of course, all age groups. There's always tensions, because that's at the very nature of the political work from local to national. And in fact, having the mechanisms in place where we can dialogue, exchange, and find a common ground is part of the work it's part of the role of an age-friendly program, for example. It's this space where voices can be heard, and a common ground can be achieved. And I think that oftentimes it's valid, right? And age-friendly cities and communities can benefit all ages if we are conscious about that from the start. Right? At the end of the day, and the same is true for child-friendly cities and communities, for healthy cities, for any other approach that you may take. But we have to have a commitment to make that work for the whole of the society from the start. And if we have that in mind, then the chances that we will succeed are much higher, right? So let's take a very concrete example. You have a limited space to build something on a certain community, right? We know that oftentimes you don't have a lot of public ground to build anything. Right? Some spaces are highly dense. So what do you do with that? You do a kindergarten, you do an open air gym for an older person, you do a public garden. So what do you do with that space, right? There are ways through which we can collectively decide on what to put in place that will benefit us all, instead of us trying to compete for that limited space and the resources that we have to actually do something with that space. And I think that in there, it's also, for me, really important to flag to you all that we are working as part of our activities on a guide called Connecting Generations, because we truly believe that to build communities, but also to combat ageism, we have to ensure that intergenerational activities, interventions are to be put in place. And we also know that some, if not planned appropriately, intergenerational activities can actually create even more tensions, right? So this is one important aspect. We know that ageism is something that affects not just older people, but also younger people as well. So it's something that they have in common. And we know that in many places, perhaps in all places now, there's no such age-friendly community that that can be created ignoring the intergenerational relationships. So all in all, to say that yes, age-friendly cities and communities can benefit all ages if we are conscious, if we have that in mind upfront, that it's important to create the structures for people to exchange and for the voices of older people and of younger people to be heard. And there is guidance on the way from WHO also to support that work globally, to build stronger communities and, of course, to combat ageism as well.
Thank you so much, Thiago. Unfortunately, we are running out of time today. It's been an active discussion, so I just wanted to take the opportunity to thank everyone for asking such fascinating questions, participating in the chat. A special thank you to Catherine Klein for sharing resources from Age Friendly World. And then Mark Venning has reminded us that next week on April 3rd is the 3rd anniversary of the IFA Global Cafés. So Mark has not missed one cafe. So he's one of our top contributors. So thank you very much, Mark. I'd like to remind everyone that we will be having a Global Cafe next week on April 7th. So please keep an eye out on the IFA's website in order to be updated on next week's speaker. Thiago, could you just kind of summarize some key takeaway messages today to share with us all?
Oh, well, first of all, just to once again give a big thanks. I think it's a great, the IFA Global Café is a great platform to exchange. I've been listening in to so many interesting discussions, and I would just like to commend you for having this platform. It's really important, and I thank you once again for the opportunity to be here. I have my own coffee through LinkedIn. I invited people you cannot see because of the background. There we go. So I'm walking the talk of the Global Cafe. I'm having some coffee with me. In terms of the takeaway messages, it's once again, we count on all of you to create this age-friendly world. If your community is already there, please make sure to engage, to contact the persons in charge, to support, to criticize if things are not working well. If your community is not there, we certainly count on you as advocates to try and raise awareness and bring this to their attention. And certainly you should also count on us, on this global family, on WHO in its different offices, on IFA, on all these global community working together to create an age-friendly world. If you haven't submitted your practices to the global database, please do so, just so that we can also amplify the message and more people can know the work that you're doing. And in doing so, we can exchange lessons. Please try as much as you can. As this is something that we're also trying to enable, to inspire others and be inspired by them. And do not hesitate to reach out, to read the documents, to engage in activities just so that you can identify solutions for the challenges that you're facing, or solutions to act on the priorities that have been identified. And of course, more and more, it's never too much to reinforce. Make sure that in every single activity or action or program that older people is central, not only to the benefits, the consequences, but also central to the decisions and to the actions that we put in place to create better people by creating better places to live in.
That's a fantastic way to end the session. So thank you again, Thiago. We really appreciate you joining us today. A special thank you also to the incredible people working at the IFA and who have supported to organize this cafe as well as every other one. In particular, I'd like to thank Luana, Ashni, and Jasmine. So I hope to see you all next Friday, and I wish everyone a wonderful weekend.